So PSG has taken a variety of different measures in order to keep both staff and patients as safe as possible during the duration of patient encounters, during appointments, or during procedures. In addition to the standard social distancing measures, keeping at least 6 feet apart wherever possible, extra hygiene and cleaning before, during, and after exams or procedures. We do COVID testing prior to procedures, or so-called pre-procedure COVID testing. That involves the use of a swab that's placed into the nose, not perhaps the testing that patients may be familiar with that, quote, hurts and goes very, very deep into the nose and in the sinuses, but a generally painless procedure where the patient does the testing themselves.
The results can take anywhere from 24 hours to 72 hours to get back.
We also have procedure rooms that are considered negative pressure. And what does that mean? Well, technically speaking, what happens in the room stays in the room. And so if there happens to be a particle of a virus or other infectious pathogen floating around, that particle will stay in the room even when the door opens or closes. The air circulates within the room, and that allows us to actually, through filtration systems that we have in place, cleanse the air and clean it after a certain period of time.
The most common one that we are using is quite scary looking. We look like we're in a movie for aliens or Martian landing. They are a rubberized mask that fits over the nose and mouth and has purple or pink filters built into the side and straps that go around the head to hold the mask in place. There's usually a vented filter lower for exhaled air, and then we will have a shield on for protection of any droplets or particles that could escape from the mask for the patient's safety.
We do not primarily treat COVID-19 patients, and so the overall risk of being exposed to those types of patients for the purposes of the patients who are trying to get their procedures done is incredibly low.
At this point, probably one of the safest places to be is a hospital or a medical center, because we are being so diligent about testing, cleaning, and masking. And it is much safer to get the medical issues dealt with rather than waiting until it becomes a catastrophe.